Now it's going. All right, so come into the room and privacy for my patient. Introduce myself. My name is Carol. I'm your nurse today. I'm going to be doing your assessment. Could you please identify yourself with your first and last name, initials only, please?
J.S.
Beautiful. Date of birth?
3/11/1941.
Excellent. Do you remember what you did your last birthday?
No, I don't.
Do you know the President of the United States?
Yes, I do.
Could you tell me, please?
Joe Biden.
Thank you. Okay. Are you in any pain today?
No, I'm not.
Okay.
Having a good day.
Good. Good. Okay. I am going to check your hair and scalp out first. Okay. I'm washing my hands. I'm going to put gloves on. And I'm going to check your scalp out for lumps or bumps or indentations, and there are none. The hair is in really good texture and cleanliness. Good hygiene. The patient is dressed appropriately for the season, and no signs of infection or infiltration of lice. So I'll take my gloves off, sanitize my hands again, and continue with the assessment. His face is symmetrical, which is good. Eyes are symmetrical. Do you feel any pressure when I press on your face here?
No.
Okay, beautiful. Sinuses are good. Checking for the temporal arteries, and it's about a 2+. Note with the checking of the hair, if my patient was wearing a beard, I would be checking the beard also, and eyebrows. So I'll go through and I'm going to check the lymph nodes behind the ear, front of the ear, parietal, maxillary. And while I'm here, can you open your mouth with some resistance of my hand? Beautiful. The patient has good coloring. Skin is in good color, warm to the touch. Lips are good color, and no apparent or obvious abrasions or wounds of any kind or scars. And the patient looks as though he's in good health. So, with that being said, I'm going to check the carotid artery one at a time. Good. Good. Now I'd like to check your ears. I'm looking at the tympanic membrane, which is a pearly gray and is in good condition. There is no drainage or infection of any kind, and you are not having any pain with your ears. No pain?
No pain.
Okay. At this point, I would also do the whisper test, but by covering up the patient's ears would set off the hearing aids. So how that would be done was that I would block off one ear and lean to the side and whisper a word to hear if the patient could hear it, and then do the reverse. The ears are in good shape. There's no breakdown. The patient wore glasses. I'd be checking behind the ear to see if there was any skin breakdown, but there is none. And then we will... Could you raise your shoulders? Beautiful. Can you raise your eyebrows? Beautiful. Can you look side to side without moving your head? Great. going to have you follow this, but keep your head still, okay? Beautiful. Good. Okay, and then I'm going to check. Just look straight over my shoulder here, okay? The pupils are reactive, and they look like they're about between 3 and 5. I would say they are a 3. I'm going to pull your lids down just a little bit. And they are pink without drainage or infection. And the lids are very healthy. There's no sign of jaundice, which is very good. And then I'm going to move down to I want to also listen. Okay. I'm going to just take a peek at your nose. Septum looks good. There's no drainage there. Could you take your finger and put it on one nostril and breathe? Okay. Do the other side. Okay. I understand that the CNA came in and took your blood pressure and it was 138 over 88, heart rate 68.
I'll take it.
And oxygen level was 99. So you're doing very well on the blood pressure meds that you're taking, and you see a cardiologist for that.
Mm-hmm.
You also see a neurologist for your Parkinson's, and you are on Levodopa for that.
Yes.
Okay. So I'm going to, I think at this time I'd like for you to close your eyes. Could you tell me what you smell?
Some kind of a scent.
Mm-hmm. Very popular one.
Trying to be vanilla, I think.
Yes, it is. Now, I'm going to test, I'm going to hit this, and I'll put it on the top of your head, and you tell me when the sound goes away. All right? There it goes. You'll feel the vibration.
Yes.
Mm-hmm.
It's gone.
Okay. When I hit it again and put it back here, it should be louder.
Yes, it is.
Mm-hmm. Okay.
Equally as loud.
Okay. Can you say ah?
Ah.
Very good. Look good. The mucous membranes are moist. And again, no lumps in the mouth. I would don gloves again and ask the patient, I could take his tongue, move it side to side, check for any kind of lumps or discolorations, but there are none. So now, I'm going to check your heart. This is your aortic. Pulmonic. Erb's point. Third costal down. Tricuspis. Fourth. And mitral valve. Could I ask you to lay down, please? I am going to I'm going to listen to your aortic in your belly and your iliacs on each side. Aortic's right in the middle. And that's quite strong. And then the femoral. Okay, I have you here. I'm going to look at your legs. I'd like to make a note that I do not have a bell on my stethoscope. So in a clinical setting, having a different stethoscope that I could turn that over and use the bell, I would do so. There is no edema in the legs. Feet are in good shape. Return blood flow. The nail beds is less than 3. I think I'd like to check your hands at this point. Less than 3. Less than 3. Okay. All right. Can I have you sit back up again, please? I would examine the chest by just looking at it, symmetrical. People with COPD have the barrel chest. This patient does not. And I would also have the patient take a deep breath and say 99.
99.
And what you're feeling for is vibrations. Go ahead.
99.
And you're doing this in the back also.
99. 99.
Okay. All right. There are 6 locations to listen to the lungs in the front. In the back there are 10. You stay away from the clavicle because you can't hear anything through that. So, just nice breaths. Start up high here in the front. I'm going to hit all those lobes. Nice deep breaths. In the back area, we'd start up high. Again, staying away from the clavicles. You've got the spine right in between there, and work your way down. Also on the back, I would want to check the kidneys. Do you feel any pain with that?
No.
No?
No.
Okay. Sorry. No pain?
No pain.
Beautiful. Okay, good. Now, I'm going to have to ask you to lay down again because I'm going to check your abdomen. Okay. When was your last bowel movement?
Today.
Okay. Tell me if you feel any pain. Any pain?
No.
Good. I'm looking for hard lumps or bumps beneath the surface, or if the patient is uncomfortable, and there are none. That was really good. I'm going to go up your feet. Can you feel that? Yep. Checking there. Those are working just fine. Can you flex your foot up? Flex them forward. How about some resistance on my hands? Okay. I'm going to bend your knee up a little bit. Is that okay? Can you do that?
Oh, no, I'm doing it. Okay.
Yes. I wanna just check how you're bending your knee. Okay. Back down. I'm not feeling any rubbing or crunching or hearing anything. Beautiful. Let's check your elbows. Beautiful. Wrist. Can I have some resistance? Okay. Fingers are good. Capillary refill good. Can you squeeze my hand? Beautiful. Okay. Let's bend this. Okay. Bend your wrist. Squeeze my hand. I'm going to check your shoulders. Good. Let's do this one. Very good. Okay. You can have you can sit up again. Okay. Can you read what's on this paper?
Yes.
Okay. Can you follow the directions?
Mm-hmm.
Okay.
Say place or drop.
You can just drop it.
Okay.
Is that your left hand or your right hand?
That was my left hand.
Okay. Just checking. All right, I'm going to give you 4 words. All right? And then I want you to count back from 20 and then repeat the 4 words.
Okay.
All right? Cat, dog, mouse, man. Count 20 back.
Backwards.
Backwards 20.
Man, mouse, cat, dog, man. Mouse.
Count back 20.
Oh.
Count back 20 first.
Okay. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Beautiful. Now, what were the 4 words that I gave you?
Man, mouse, cat, dog.
Great. Could you stand up, please? Okay. Could you walk to the doorway there, toe to toe, and then turn around, and come back?
Toe to toe.
Now, can you walk on your toes?
Yes.
Okay. Beautiful. Okay.
That's what you meant, toe to toe.
Yeah.
I didn't know that.
That's okay. That's okay. You can sit down again. Can you take your finger and touch your nose?
Eyes open or closed?
Eyes closed.
Okay. Can't miss.
Okay. Okay. How about the other one? That's good. Squeeze both my hands real tight. Okay, I'm going to lean into you. I want resistance from you. All right? Good. All right. Push your foot up against my hand. You push your shin.
Oh, push.
Yep. All right. Let's do this one. Okay. That's good. That's good. Well, I believe you are in very good health, and you did very well with this assessment, and I appreciate the time that you took
Thank you.
to let me do this. Okay. In an ending note that my patient is on blood pressure med, doing very well with that. Again, with the Parkinson's med has been successful and is doing very well. So I thank you.